Thank you. Well, it's great to sort of not quite see you all today, but to be able to sum up this great conference. It's been a really interesting day. I've really enjoyed it. So I was delighted to be invited to do this, although I have to say slightly daunted as well, to sum everything up of what has been such an interesting and busy packed day. But first of all, I ought to sort of just, I'd like to just thank a few people. So next slide. You know, having organised conferences myself, I'm very aware of how much work goes into all of these, the organisations. So I really want to thank the Welsh Value in Healthcare Centre, particularly Sarah, Gareth, Lawrence and Sam. For, you know, doing all the hard work behind the scenes of supporting this and doing the tech. Also, Dr. Sally Lewis, who's the director of the Welsh Value Centre in Health, who fantastically opened the conference this morning. All the chairs of the parallel sessions who've got a challenging job to make sure everything runs on time. Thanks for doing that. All the plenary speakers and the presenters, everything went very smoothly, some fantastic talks. Also like to thank Dr. David Churchman and team at Oxford Innovation Limited for sponsorship, and to Kathleen Withers and the scientific committee for all the hard work that goes into reviewing, selecting abstracts, all the abstract reviewers that committed their time to do that, and to Tim, Grace, Amanda, Trish and John from the UK PROMs special interest group from ISOQOL, who offered lots of support and advice throughout this, and also to ISOQOL for endorsing this conference. And as president of ISOQOL, it gives me great pleasure that ISOQOL is able to support this conference. It's going from strength to strength, and it's fantastic to see that it's put on every year. I should say also, though, that the views that I express in this presentation are mine and not necessarily those of ISOQOL. So big round of applause for everybody. I know we can't, but I'm just going to do that. So thanks very much. Next slide, please. And sort of before I go on, I thought I'd just take this opportunity a little bit for those of you who are not familiar with the International Society for Quality of Life Research, just to tell you a little bit about ISOQOL. They're a global community, as it says, of researchers, clinicians, healthcare professionals, industry professionals, consultants and patient research partners with the aim of advancing health-related quality of life research. So it's an international network, a kind of global community of some 12,000 members across different continents of the world. Next slide, please. And I guess the vision for ISOQOL is to improve quality of life for people everywhere by creating a future in which their perspective is integral in health research, care and policy. And I think we've seen a lot of that today, and that's been fantastic to see, particularly the patient involvement that's been integral to a lot of the presentations that I've seen. And the mission of ISOQOL is to advance the science of quality of life and related patient-centred outcomes in health research, care and policy. And I was very struck today by, I suppose, the different communities that exist in this space. So there's the sort of researchers that develop the measures, and then there's all the people who use these measures in policy, research and clinical practice. And often there's a lot of overlap between those communities, and sometimes there isn't. So I think it's great when those communities can come together. So next slide, please. And there's lots of things that ISOQOL do that you might, if you're not already a member, that you might consider joining. So we put on lots of events. I'll talk a little bit about one of those in the moment, but obviously one of those is this event. We offer a lot of e-learning programs. So there's a number of educational programs, including online courses, webinars, symposiums, and they can all be found on ISOQOL's website. And also we have a regular sort of science-focused newsletter that just appears on our website that updates people about key issues and key publications that have been published recently. And talking of that, next slide, please. We also have a number of journals, including the Journal of Patient-Reported Outcomes, Quality of Life Research, and I'm sure many people are familiar with those. We also have a dictionary of quality of life and health outcomes measurement that provides useful definitions of some of the terms that I've obviously heard today. Next slide, please. And of course, there's the annual conference, which this year is going to be held in Prague on between the 19th and the 22nd of October. And at the moment, fingers crossed, that's going to be an in-person conference. Obviously, the last 2 years we've had our conference online, but this year the plan is still to have that in person. And yeah, hopefully we can see each other in Prague then. Okay, next slide, please. So that's just a little bit about ISOQOL for people who are not familiar with who we are, but I was really excited to be asked to sort of sum up today's plenaries and presentations, and as I say, it was a bit daunting. So I had looked at the abstracts beforehand and looked at the programme, and like any good qualitative researcher, I got my highlighter pen out and my post-it notes, and essentially I think what I did is a sort of qualitative thematic of analysis of what all the sessions and the abstracts we're talking about. So I guess what I've got for you today is some common themes around that, and rather than necessarily highlights, although I think they're all highlights, but definitely some common themes across the presentations which I saw today and really enjoyed. So next slide, please. And I think that some of the sort of key common things that seemed to come out was the use of patient-reported outcome measures in practice at different levels of the system. So I'll talk a little bit about that. And as we've seen from the last presentation from Simon Barry, was the value and use of PROMs in the wake of the COVID-19 pandemic, which obviously has been a very dominant feature of everybody's lives in different ways over the past 2 years. And also the issue around patient voice and how we can bring patients' voice to our research, and also to ensure equality and diversity in the way that PROMs are developed and the way that PROMs are used. And then also really exciting methodological and conceptual innovation in terms of how we measure, interpret, analyse PROMs. So those are sort of some of the key overall themes that I guess identified from today's talks, and I'll just talk a little bit more about each of those, and then that will be the end of today. It's gone very quickly. So next slide, please. So I guess one of the first sort of themes I identified was, a lot of talk about using PROMs in practice at different levels of the system for different purposes in different settings. And one of the sort of key challenges, I suppose, and some of the possible solutions and some of the sort of key issues that I gathered from the presentations that we saw was this issue around standardization, and how can we ensure that the PROMs that we use across different levels of the system are standardized, so that we can make use of the different uses, also realize those. So the idea of using PROMs to support doctor-patient communication or clinician-patient communication, using PROMs to track people's symptoms and health-related quality of life over time, using PROMs at the system level to benchmark and to use for quality improvement. These all rely on having standardized measures, so using the same measures in different areas, and also for particularly for benchmarking, making sure that the PROMs that we use are the same, so that we can do those comparisons. And there was obviously really useful presentation around from the Cosmin group about how we might select measures to do that. But that comes with, I guess, some challenges in terms of managing that tension between standardization and making sure whatever we do use actually fits the needs of the people using it. And there are lots of different stakeholders involved in using PROMs across the different system, and making sure that all those needs are met. I think, can be a challenge. And I guess the other challenge also was the issue around interoperability, and making sure that where we move data from one place, one part of the system to another, how can we do that, both from not just from a sort of technological standpoint, although that's certainly an issue, and certainly one of the sort of middle plenaries talks about that, about this idea of having different apps for different conditions, and how do we make sure that we don't overburden patients with lots of data collection, but more importantly, how do we bring all that data together? And I think that's one of the really sort of challenging things. But also, how do we make sure that that data, when it's moved from one bit of the system, is interpretable and people can understand it, and that whatever, I guess, context that helps people to understand data, say, for example, from an individual patient, when that gets aggregated to an entire service, how do we make sure that that data still becomes usable and interpretable? I think that's really one of the interesting challenges. And then another dimension to that is the issue around using PROMs data ethically, particularly around data sharing, particularly around the kinds of PROMs we use and how inclusive they are. But also, how do we make sure that whatever data we collect is used effectively and there isn't any waste? So Mel Calvert's presentation talked very much to that, with some ethical guidelines that have been developed by her team. Next slide, please. And obviously, another key area that was talked about today was PROMs and COVID-19, and particularly in terms of how can PROMs, I suppose, enable us to measure the impact, particularly of long COVID, and inform the support of people with long COVID. And obviously, Simon Barry's presentation talked very much to that. Astonishing, quick. I think this is the thing, it's been very rapid. People have on the ground have had to move very quickly to respond to COVID, and to sort of develop that app and to get all those downloads and get the people using it is fantastic. PROMs have a huge role to play here in terms of capturing that. So obviously there's been a need to sort of develop some new measures, to use those measures to capture the impact of long COVID, so that we can use that data to inform service provision for people themselves, to enable self-monitoring of COVID over time. And I think a key component of that, I think, has been this sort of co-production ethos that has gone throughout the sort of measurement, to make sure that whatever is measured is actually relevant to people who experience long COVID. And I guess this brings me on to the kind of next theme. If you want to do the next slide, please. And this is something I think that is really, really important in terms of co-producing PROMs with patients and caregivers. And I saw a lot of presentations around that theme today. And I guess it begs questions of how can we move from patients being research participants. So, for example, when we develop a PROM, it's very standard now, although it wasn't always the case, to interview patients to gain insight into how their condition affects their lives in order to generate items. But I think increasingly now we're thinking much more broadly around, well, actually, how can we make sure that patients are research partners, so they have involvement not just as participants, but in steering the direction of that research and helping inform the sort of design of the PROMs, and from not just as kind of suppliers of item information, but all the way through the research process. And another element of that is also thinking about how we can improve the inclusivity and diversity in the way that we develop and apply PROMs, in terms of people from different backgrounds, low-income backgrounds, different ethnic and racial backgrounds, who often for various reasons are not included in the way that PROMs are developed or in the way that they're used. So I think those are sort of really important issues that will continue to be addressed as we move forward. Next slide, please. And then finally, it's almost like we have the sort of bread and butter in some ways of what PROMs developers do, and this is methodological innovation and conceptual innovation in terms of how we conceptualize the concepts that PROMs try to measure and how we measure them and how we develop those methods and how we interpret PROMs data and how we analyze it. So I saw lots of really interesting presentations around issues around how do we define the minimal clinically important difference, and what role does baseline, how does baseline PROMs data influence that? And how do we then develop PROMs in a way that incorporates people's views? How can we ask different questions about the way that we conceptualize the concepts? How can we bring patients into those? How do we incorporate big data sets, and how can we harness the use of big data sets to pull together items from different measures to develop a new one and bring all those concepts together? So it was great to see all of the presentations, and it's really good to see all this research happening and sharing of this information. So next slide, please. So really, I mean, I think for me, this is a fantastic example of how the sort of PROMs community is alive and well. And it was great to see people on the ground today, from the Welsh Value in Health Centre, talking about how they have used PROMs at a system level to incorporate, to make use and to inform care and policy across the system. And that was fantastic to see. There's lots of really high quality and innovative research going on the ground. And it's been really useful, I think, to bring different communities together. So to bring people from policy, from practice, together with those people who develop the PROMs and can help you choose the PROMs. So the COSMIN presentation was a fantastic example of that, to help you think about, well, how do I go about selecting a PROM? And then we also have presentations of, okay, this is how you can use the PROMs on the ground. And I think, this is a really good opportunity to actually bring people together from those different overlapping communities and to enable networking to happen. So I hope that has happened as a result of today. So that's about all I wanted to say. Thanks for the opportunity, and I hope you've enjoyed today, and you'll be back for tomorrow. Just a final slide to remind you that if you do want to find out more about ISOQOL or become a member, then you can go to this website. Thank you.